Hello staff. Yesterday evening, I was informed that an employee at the Metro Regional Youth Detention Center has tested positive for the coronavirus COVID-19. Prior to receiving confirmation of this case, we had already taken steps to control the spread of COVID-19, and we immediately took additional steps to determine the exposure level to staff and youth. The employee last reported to work on March 16th and currently is under care of medical professionals in a local area hospital. Due to HIPAA Privacy Act, I'm unable to divulge the staffer's identity, but ask that you keep the team member in your thoughts and prayers. We discovered through our investigation the employee worked in a limited capacity in the facility and had no contact with our youth and minimal contact with staff. The area where the infected employee worked has been cleaned and disinfected. We are in the process of identifying any coworker that may have come in contact with the exposed. We will monitor on a daily basis all youth and employees that are exhibiting signs and symptoms of COVID-19 and provide appropriate guidance for exclusion and/or isolation. Due to our diligent and proactive cleaning and hand washing practices since early March, it appears no spread has occurred to other staff from this individual case. In the wake of COVID-19 intrusion, we are continuing to follow the CDC and DPH guidelines and best practices to further prevent the spread of the virus while protecting the youth and staff within.
Since early March, DJJ has incorporated rigorous measures to safeguard against possible transmission of the COVID-19 infection in our facilities and offices. These measures include allowing staff to telework whenever possible in order to promote social distancing, suspension of visitation between youth and family members, suspension of all volunteers entering the facilities, screening and temperature checks for all correctional officers, visitors, and other staff entering the facilities, an aggressive and extensive cleaning schedule that disinfects all areas within the facility, soap and hand washing availability, as well as hand sanitizers made available to all staff, screening for all admitted youth, including the continuation of monitoring the health status of youth while admitted to the facility. Due to multiple signs and symptoms of COVID-19, assume anyone can be infected and practice these prevention measures. Complete a self-examination each day before reporting to work. Stay home if you are ill and notify your supervisor. Avoid close contact with people who are sick. This includes family members. Practice social distancing of 6 feet whenever possible. Cough or sneeze into your sleeve or elbow. Wear a mask if you have these symptoms. Avoid touching your eyes, nose, and mouth with unwashed hands. Wash your hands often with soap and water for at least 20 seconds. Use an alcohol-based hand sanitizer that contains at least 60% alcohol if soap and water are not available. If youth exhibit symptoms within the facility that require isolation, you should wear personal protective equipment or PPE only if you are in direct contact with the youth.
We ask that you please remain calm during this time of crisis. We are working diligently during this pandemic to protect you and your family against COVID-19. If you need any additional information regarding this virus, please utilize reputable websites such as CDC or Georgia DPH. If you need further support in your emotional health, please do not hesitate to contact our Employee Assistance Program at 1-833-276-0988. Thank you for all that you do for the state of Georgia, this agency, and the youth in our care. God bless.